Hello everyone. This is your internationally recognized Harvard and Yale educated board certified dermatologist, Dr. Dina Strawn. I'm the founder and director of Aglow Dermatology in New York City. And I am coming to you now with your Skin Win with Dr. Dina. And this is where I share my expertise in dermatology to help you win with your skin, hair, and nails. So today we are going to talk about why it's important to get a diagnosis for your hair loss. And what inspired this topic today was a number of patients that I saw this past week in the office who, many of whom had come in and had already seen someone for their hair loss. Some had seen board-certified dermatologists. Some were under the care of non-doctors, PAs, and had never seen a board-certified dermatologist for their hair loss. And, one of the reasons why they had come to see me was that they were not making any progress and they didn't know what was going on with their problem. And, I would start with they weren't actually aware of their diagnosis. So I talk about this. It seems like it's an obvious thing, but a lot of times people just accept alopecia, which is just the medical term for hair loss, as a diagnosis. And in some ways that can be a diagnosis. It's a very vague diagnosis, but I really feel like it's more of a symptom, and that's what people come in with complaining of. They come in complaining that they have hair loss. So when someone just tells you, oh, you have alopecia, they're really not telling you something that you didn't already know. And there are reasons why it's important to go deeper and get more information before you start on a treatment regimen. And I what I was seeing in the office was really quite kind of disturbing to me. I mean, I had actually 2 patients come in who had undergone patch testing as part of their alopecia workup. And, I can't help but feel that that was exploitative of the patient and their insurance because, allergic contact dermatitis is not a common cause of hair loss. And, these patients hadn't had biopsies. Someone who's a specialist should know, the difference between seborrheic dermatitis, which is quite common, and, know how to treat that before doing a very expensive patch test panel on someone that's not really helping their problem because they don't have allergic contact dermatitis. But I saw this multiple times. So I just wanted to make sure people were aware of what they could do to, protect themselves and make sure they're getting good care to help them with the problem, because hair loss is really disturbing to people. It's not life-threatening, but I feel like sometimes people don't think it's important to give people the top quality care, to work them up, to go in the right direction, to give them accurate information. It's like, oh, it's just hair loss, it's just cosmetic. I mean, it's quite disturbing for people. It's life-altering. And when you know what it is and you know what you're doing, you can really help people and transform their lives, because we only have so much time on earth, so we want to make it the best that we can, and most of us want to do that with our hair. So why is it important to get a diagnosis for your hair loss? So the first reason is that there are different types of hair loss. So as I said, noting that someone has alopecia is not really a diagnosis. There's usually a type of alopecia. So, we have the most common androgenetic alopecia, or we also call it male pattern hair loss or female pattern hair loss, male pattern alopecia, female pattern alopecia. That's the type that we think of the, balding that runs in the family. And, men and women get it too. It tends to present differently on women and a little less severely generally. But women who have hair down to their hips often come in with androgenetic alopecia. So alopecia just means hair loss. And, the why of your hair loss does matter. So, number 2, kind of just expanding on that, is that there are different categories of hair loss too. And the main 2 categories are scarring and non-scarring hair loss. And under each of those categories, there are many different diagnoses which have different treatments. But the main thing with the categories is that, if you have scarring hair loss is potentially permanent. So even when you come in and we try to treat you, scarring hair loss, we may not be able to get your hair to grow back if it's progressed too far. So, the sooner that you can come in and get the correct diagnosis, scarring or non-scarring, and then the type, particularly if you have scarring hair loss, the type of scarring hair loss that you have, you can potentially save your hair, perhaps get some hair to grow back from the follicles that are maybe damaged but not dead, and then protecting the rest of your hair follicles from irreparable damage. It's important. So someone wasting your time for months or years with treatments that are not helpful can result in a delay in permanent hair loss. So it is important to find out what category you have, and the treatments are different. And number 3 is that, again, it's like an expanding on this, how we treat hair loss really depends on the kind of hair loss you have. So we can correct things, when we know the cause. It's sort of like, how long does it take to get to LA? Well, it depends on where you are. So if you're in New York, it's going to take a different amount of time to get to LA than it would if you were in Nevada, or if you were in San Diego, or if you're in Seattle. So, and how you're going to go about that. So it's just very important. I just see people who come in and, they don't even have a diagnosis, not even a biopsy, and they've already been put on some of the treatments that are quite expensive, but, not necessarily appropriate for every type of hair loss. So they've, someone's got them on PRP and laser cap and come in every week and we're going to do this treatment, and they don't even know what the diagnosis is. And I feel that's exploitative, and I feel like patients should be aware of that, and that, there are great treatments for hair loss out there. The sooner you come in, the better for you, the better result you get. Hi, Dr. Drayon. Thanks for watching. And like I said earlier, don't just accept alopecia as a diagnosis. They should be able to tell you what type of alopecia, what type of hair loss you have. You want to know scarring or non-scarring, and then under those 2 categories, you want to dig deeper and find out what you have. And one of the best ways to do that is with a biopsy. You don't always have to get a biopsy for your hair loss. Sometimes you can diagnose hair loss, particularly if you're seeing a hair loss expert, with clinical exam and history. But even if you get a biopsy, it's not a scary invasive procedure on the scalp. It's really, we clean the skin with alcohol, we inject a little numbing medicine, and then we take a cookie cutter shaped scalpel about the size of a pencil eraser and take out a little plug of skin and send it to the lab, and you get 1, maybe 2 stitches, sometimes 3. And, hopefully with that specimen, a dermatopathologist who's an expert at reading hair specimens can provide some helpful information. Sometimes it's still vague, but they can usually give you the category of scarring or non-scarring, how advanced something is. It can be helpful. So if you're walking around with alopecia or hair loss and you haven't had a biopsy, I would insist on getting a biopsy before I would start doing a lot of those expensive treatments. So, try to get as clear a diagnosis as you can. So, referring back to that old Abe Lincoln saying, if I had 6 hours to chop down a tree, I would spend the first 4 sharpening the axe. Think of getting your diagnosis as sharpening the axe. Very important. And it can be done quickly. Sometimes it takes a little bit more work. But that's all for now. This is your internationally recognized, Harvard and Yale educated, board certified dermatologist, Dr. Dina Strawn, and this was your Skin Win with Dr. Dina. And if you got some value, like this, share it with your network, and follow me on social media at drdinamd.com. And if you are in the New York area and you need some help with your hair loss, you can come check us out at aglowdermatology.com. We help a lot of people with hair loss, and it's one of our passions. Anyway, you enjoy the rest of your weekend. Take care now. Bye-bye.